Well, here we are with Dr. Fankhauser from Wichita, Kansas, a dentist. How are you doing, Dr. Fankhauser?
Well, I'm doing just great.
Well, all right. Dr. Fankhauser, you're a dentist and you've been a dentist for a bunch of years. Tell me, there is as patients, sometimes, some of us have a tooth or 2 or 3 teeth missing in the back, because usually in the front we exchange them right away. It looks ugly like hell, but like in the back. And frankly, nothing bad is happening, at least not in our mind. And yet every dentist keeps telling us you've got to exchange, you've got to fill those gaps, you've got to put replacements in there. What's the deal there? On one hand, nothing bad is happening, it looks like. On the other hand, you dentists put such an enormous stress on replacing them. Can you shed some light on that, Dr. Fankhauser?
Well, a little bit, yes. If you have teeth missing in the back, it may not hurt. It may not. You may still be able to eat, but slowly, gradually, over time, your bite will collapse, and then you end up losing all the rest of your back teeth. So we try to prevent that by replacing the teeth that are missing.
What does the bite collapsing mean?
Well, the teeth will gradually move into whatever space is available. And so if you have a space in the middle on the bottom, the teeth in the back will cave forward, the ones in the front will cave backwards, and then it messes the way your teeth touch together when you chew, and that can cause a lot of problems, even headaches.
Wow. So basically what you're telling me, it's a little bit like a fence, when you have all those little balls on the fence and then a couple of them start missing, they get a little crooked, and next thing you know is the whole fence plays like piano, and it not only looks ugly, but it loses its purpose and falls apart heavy.
Exactly.
And you say, this is something very interesting, you say it can even cause headaches, because I've heard from other people, or dentists actually, that they say, shoulder pains, neck pains, stiffnesses, and all because, your mouth starts getting crooked.
Yes.
Yeah?
Yeah.
Wow.
If the teeth are not matched up together correctly, then it can affect the way your jaw sits relative to the rest of your head, and that can cause strain in your muscles, so you get like a muscle fatigue in your chewing muscles, and that can cause headaches.
Wow, so from
extra wear and tear on the teeth,
Right. Well, from an engineering viewpoint, that makes lots of sense. Me being a kind of a mechanical machinery engineer, like when you have, let's just say, just a door hinges in, and if one hinge is more used than the other one, obviously one wears out a little faster, and something, it starts getting a little crooked, and the door doesn't fit, and then all kinds of stuff are happening. Same with corpus in a machine. So I can see that. So let me ask you, so if a person, let's just say, has had headache and muscle tensors, and he has tried all kinds of things, has taken his share of aspirin and name it, would it be a good thing for him to say, well, let's go to a doctor and really see whether there's anything going on in my mouth which is out of alignment? That's basically what it is, right?
Yeah, it's kind of like driving around with your wheels out of a line. So it causes a lot of extra wear and tear, and a lot of times the little disc that's in between the jaw and the skull gets knocked out of place, and so now it's not working anymore. Now you're rubbing your bones together. That doesn't work very well.
Nope.
So a lot of things can go wrong.
So got to replace those teeth. Of course, I'm sure we're going to have some conversations there. First, try not to get them missing in the first place, but once they are missing, then they should be replaced. And even if all teeth are in it, those alignments, those disalignments could possibly happen, right?
Sure. Yes. A lot of people are walking around with all their teeth, but they still have some misalignment, and it could be from the way they grew in, or maybe they had some orthodontic treatment, teeth got moved a little bit, and now they don't fit together just right. Or they might have gotten an injury. Maybe they got hit with a basketball at the age of 10 and knocked their jaw out of place. So a lot of things can happen in life.
Right, I can see that. So basically, a dentist, in that extent, from what we talked now, you can look at this yourself like as a chiropractor for your mouth, putting things in alignment. Because, if your back is out of alignment, all kinds of shit starts happening. And same here. I like that.
Well, sure. We're able to take a look at a lot of those things. If the teeth are not missing, then we can realign them basically so that the bite's correct and everything's working the way it's supposed to. If the teeth are missing, then we have methods of replacing teeth, either with bridges, removable appliances, implants, things like that.
Right. And we're going to talk about that a lot more in other videos of how we can replace them. But so the first message obviously is your mouth could be out of alignment, whether you have all the teeth in or not. Much more, of course, if they're missing. Never mind that when teeth start faltering like an old fence, one affects the other one, and next thing you know is your teeth in front start looking ugly, and that is really spelling disaster. Well, thanks a lot, Dr. Fankhauser. I'll speak to you soon again.
All right.